please put them in the chat. We are also recording this, so you guys can have the link to the recording when we are all done. So again, welcome. I'm glad you all are here. Learn about the Medicare Savings Program. I'm Helen Roy. I am the Education and Outreach Coordinator at Consumers for Affordable Healthcare. So our mission at CAIC is to advocate the right to quality, affordable healthcare for every person in Maine. Here at CAIC, we are Maine's health insurance consumer assistance program. We help consumers and professionals. We screen consumers for eligibility for Medicare and marketplace coverage and then help them apply. A lot of folks come to us through our helpline. We also offer guidance and sometimes take on private insurance appeals when a consumer's medical care has been denied by their private insurance company. We help professionals through workshops and trainings such as this one. Many assisters call us with eligibility questions and questions about Medicare denials. And then our policy and advocacy work takes us to the legislature and from time to time to various state agencies. We have Coffee Cake, our weekly e-newsletter. So let us know if you want to be put on the assister listserv or if you want to be on the list for Coffee Cake. And here is our agenda for today. We're going to go over the differences between Medicaid and Medicare. We're going to go over the Medicare Savings Program and then the program here in Maine, the income limits and the asset guidelines. And then we're going to work on determining eligibility by first looking at how households are constructed and then how to calculate countable income. And lastly, we will go over how to apply for the Medicare Savings Program, and then once someone has it, the annual reviews. So what is the difference between Medicaid and Medicare? So Medicare, it's what everybody, when it's for those who are 65 and older, or for someone who is younger but has been deemed disabled by the Social Security Administration. It's uniform across the country. It has premiums and out-of-pocket costs for medical care and prescriptions. Medicare Part A covers hospitalization. Medicare Part B covers doctor visits and outpatient services. And Medicare Part D covers prescription drugs. Medicare Part A may be free to those, may be free to the beneficiary if they've worked 10 years or 40 quarters. And people with Medicare may also have Medicare if they are below the income and asset limits for Medicare. These folks are commonly referred to as dually eligible. People with Medicare and Medicare may also have the Medicare Savings Program if their income and assets are below the limits for the Medicare Savings Program. So Medicare, Medicaid, here in Maine, it's known as Medicare. It's health insurance coverage for folks of any age who have limited income and resources. It's a cooperative program between the federal and state governments, and it's got funding from both sources. And Medicaid programs do vary state by state. Some folks with Medicaid may have small co-payments. Benefits under Medicaid are comprehensive, hospital, doctor visits, prescription drugs, and dental care, along with transportation, long-term care, and additional healthcare services and supplies. And for Medicaid, eligibility is based upon financial need, citizenship, and status and category. So again, with Medicare, there isn't that eligibility piece of it. Everyone who is 65 or older or somebody younger who's been deemed disabled can pick up Medicare. Let's see. So the Medicare Savings Program, how many of you are familiar with it, or have you worked with it before? Dana Johnson is saying she has. Does anyone else? Nancy Johnson is saying she has. So it's when Main Care helps out with the Medicare premiums and the out-of-pocket costs. So it's Maine's Medicaid program helping folks cover their Medicare out-of-pocket costs and premiums. So to be eligible for the Medicare Savings Program, the applicant needs to have or be eligible for Medicare Part A. There are 3 benefit levels in the Medicare Savings Program. The first one is qualified Medicare beneficiary. People refer to it as QIMBY. Specified low income beneficiary, that's also known as SLIMBY. And then qualified individual is QI. And you may hear somebody say, well, I've got SLIMBY or I've got QIMBY. There are 3 income limits for the 3 different levels, but the asset test is the same across the 3 levels. And with the Medicare Savings Program, there is no estate recovery. Thanks, folks. I'm seeing a lot of people are familiar with it. And one attendee is saying they have it too. So this is good. So coverage, it covers the Medicare premiums for Part A, and if applicable, Part A if applicable, and then the Part B and Part D premiums. It covers those lifetime penalties if applicable, meaning someone didn't sign up for A or B when they were supposed to, so now they've got that penalty. So when someone picks up the Medicare Savings Program, the MSP is also covering those penalties. And then it covers prescription medications, the Part D deductible and the donut hole, and the person that's got the that has the MSP has small copays for their meds. QIMBY, it's the most generous benefit. The income limit is 150% of the FPL, and people with QIMBY have all their medical care covered. They do not get a doctor bill. SLIMBY, the income level is 170% of the FPL. SLIMBY does not help with Part A. People with SLIMBY are responsible for the Part A deductible and the 20% co-insurance if they go into the hospital. SLIMBY does take care of the Part B premium, and this can be a huge benefit to those on limited incomes. Beneficiaries are responsible for the Part D deductible, copays, and co-insurance. SLIMBY covers the Part D premium, deductible, and the donut hole, and beneficiaries have small copays for their medications. QI works the same as SLIMBY, covering Parts B and D premiums and the Part D deductible and the donut hole. QI beneficiaries, excuse me, also have small copays for prescriptions. And the income limit for a qualified individual is 185% of the federal poverty level. The MSP helps with the Part D donut hole, and the donut hole refers to the gap with Medicare Part D prescription drug coverage. After you and the drug plan have spent a certain amount for covered medications, it's $4,430 for 2022 and $4,600 for 2023. Once you've paid that much and the plan has paid that much, you're in the coverage gap. And then once you've spent up to the yearly limit, your coverage gap ends and the drug plan helps pay for covered drugs again. And again, remember, there's also an asset test, and the asset test is the same across the 3 levels in the MSP. So here is the MSP in Maine. And according to Kaiser, the Kaiser Family Foundation in 2020, there were 78,620 Mainers who had QIMBY and 7,910 Mainers with SLIMBY. So that's roughly 86,500 Mainers who got their Part B premium back, along with help with other out-of-pocket Medicare costs and help with Part D premiums and medications. So Maine, we have higher than federally required income and asset limits. The Fed sets the income limit at 100% of the FPL for Quimby, and the federal limits for assets, it's 7,790 for a single person and 11,960 for a couple. So keep in mind that those asset figures are the federal limit and Maine's are higher. And here, the low income subsidy and the Medicare savings program. So you may hear somebody say, I've got extra help or I've got LIS. And what that is the low income subsidy lowers the cost of Medicare Part D and lowers the cost of prescription drugs for those who are eligible. It does, whoops, hit the wrong button. Sorry about that. It does not replace the Medicare Part D plan. Medicare beneficiaries enrolled in the MSP are automatically qualify for LIS, the Part D low income subsidy. But it doesn't go the other way. Medicare beneficiaries eligible for LIS are not automatically enrolled in the MSP because of Maine's higher income thresholds. So when you're working with someone and they say they've got extra help, ask them if they also have the Medicare savings program. And if they don't, if they say they don't rattle off Quimby, Slimby, or QI or the MSP, they don't know what the MSP is, screen them for it, see if they are eligible, because chances are they might be. And that's why I put this slide in here, because someone might have LIS and not realize they're also eligible for the MSP. And then according to CMS, as of June 2021, there were 80,176 Mainers enrolled in LIS and the MSP. There were 2,196 Mainers enrolled in LIS, but not the MSP. And that's 2.7% of LIS enrollees not enrolled in the MSP. And, you know, maybe one of those folks in that 2,196, maybe they are eligible for the MSP and could get extra help with, or more help with their Medicare costs, and maybe get the Part B premium back. So here are the income and asset limits for the 3 tiers in the Medicare savings program. And as I mentioned earlier, Quimby is 150% of the FPL, Slimby is 170%, and qualified individual is 185. And the asset limits, for a single person, it's $50,000 in liquid assets with 8,000 excluded. So in essence, for a single person, it's $58,000 in liquid assets they can have. For a couple, it's $75,000 in liquid assets with the first 12,000 excluded. So in essence, again, it's $87,000 in liquid assets they can have. And the numbers shown here for the income limits are the raw numbers that DHHS uses when comparing countable monthly income to the income limits. You may see the income limits with the disregards added in, making the numbers higher. And I am going to go over the disregards when we get to the income section. And again, you may see the asset limits at the higher amounts, the $58,000 for a single person or $87,000 for a couple. And with the assets, it's only liquid assets that count. And liquid assets are those things that can be readily, easily turned into cash. The liquid assets don't include things like a boat, a camper, a motorcycle, a car, or jewelry, because it takes some time to sell them, to convert them into cash. So keep in mind, it's liquid assets. Things like savings accounts, checking accounts, retirement accounts, certificates of deposit, annuities. For retirement accounts, it's only the net amount available upon liquidation that counts. For annuities, it's the current cash value that's available to the individual minus any penalty fees for withdrawal. Any monthly annuity payments that the applicant may receive is counted as income. Any questions? Okay. So Patricia King is asking the penalty for how long? And yeah, it's a lifetime penalty, and it happens when somebody is supposed to sign up for Medicare, and they don't, and they try and sign up later. Like, just I hear a lot people who may have the Part B penalty because they didn't sign up when they were supposed to. And unfortunately, it is a lifetime penalty. So folks who are eligible for the MSP covers that penalty for them. Okay, so let's move on to household. Oops, Cordelia Hill's got a question. Would veteran pension benefits count as income even if not taxable? I think they do, because just about everything counts as income with the non-Magi formula. So, oh, there's another question in there. Let's see. So how does someone apply for Quimby if they already have main care? I would get in touch with eligibility, get in touch with the Office of Family Independence, and ask to speak with an eligibility worker and mention that I've already got main care. Can you please screen me for the Medicare Savings Program? And remember, they've got to either have Medicare Part A or be eligible for it in order to pick up the Medicare Savings Program. So now let's talk about household construction. So the household for the Medicare Savings Program is determined by the applicants. They're living in the same space, and they are related by birth, marriage, or adoption, and among whom there are legal responsibilities. So they need to meet all three of these criteria to be counted in each other's households. And then number three, wondering, what does it mean to have legal responsibility for somebody? So spouses are legally responsible for each other. Parents are legally responsible for their children aged 18 and younger and live with them at least 50% of the time. Married couples not living together in the same space do not count for each other. And then an unmarried couple with a child in common can be in the same household. So let's take a look at this. Here we've got sisters, Ruth and Harriet, and they live together. They are related by birth, but they are not legally responsible for each other. So therefore, they are not in each other's households for the Medicare Savings Program. Each of them is a household of one. Now we have Viola and Al, and they are married and living together. So for the Medicare Savings Program, they are in each other's household because they are legally responsible for each other and they're living together. Peter, he's disabled and he lives with his 11-year-old daughter. He is responsible for her. She counts for him in his Medicare Savings Program household. So he's a household of two. Ray, he's widowed and he lives by himself. So he's a household of one for the Medicare Savings Program. So remember, to be considered for people to be considered in the same household for the Medicare Savings Program, all three of these criteria need to be met. I'm just checking the chat. Don't see any other questions yet. So Martha put up a Quimby's Part D drug plan said the person must pay copays until she meets her $480 LIS deductible. Shipping Medicare said that this is incorrect. That copay should be $0. Rep Pingree's office is confirming what the contract between the drug plan and CMS says. Is there anything else that should be done? If I get a call like this, I refer them to Legal Services for the Elderly. They have a Part D drug unit, and they get into this. This is what they do. Here at CAKE, we help people with main care. We help people with the Medicare savings program. And we also help folks with the marketplace coverage at Cover Me. Medicare itself and the extra help program, those two are not in our wheelhouse. So if you're working with somebody, as Martha is saying, also LSC is saying the Part D unit said they can't do anything. And yeah, this is something we couldn't help with either, because this is not what we do. We don't handle Medicare. We don't handle the extra help program. Yeah, I don't know. I don't know what else can be done. So let's skip back to the household construction here. So again, these three criteria need to be met in order for people to be in each other's households. So for an example here, we've got Dan and Donna. Dan, he's self-employed, and he and his wife have 2 minor kids. They file their taxes together, and they claim both children. Dan's mom, Donna, she's 66 years old and retired, and she's got Medicare, and she is living with Dan and his family. But Donna, for the MSP, is considered a household of one. Although she lives with her son, there's no longer any legal responsibility between them. He's over 18, so she's not responsible for him. So she is a household of one. So here, I'm going to launch the one and only poll we have in this workshop, and it's over household construction. So you guys should all see it now, and feel free to go in and answer the questions. So for the first one, oh, and be sure to slide the slider on the right-hand side, because there are multiple questions here. So for the first question, choose all that apply. What are the 3 criteria for constructing the Medicare Savings Program household? And then Karen is 65 and Tom is disabled. They're married but do not live together. Is Karen in the same household as Tom? Karen is 65 and Tom is disabled. They are not married and they live together. Is Karen in the same household as Tom? When I see a typo there, is Karen in the same household as Tom? Karen is 65 and Tom is disabled. Karen and Tom are married and living together. Karen's 42-year-old daughter lives with them. Is Karen's daughter in the same household as Karen and Tom? And then the last question, is Karen legally responsible for her 42-year-old daughter? Let's give it a little bit. And I encourage you all to take a crack at it. Try and answer the questions. Going to give it maybe 10 more seconds.
Hey,
Okay.
Helen, how do you figure out legal responsibility? Is that based on taxes alone, or is there something else?
No, trying to go back to that slide. There we go. Whoops. So, legal responsibility, people who are married are legally responsible for each other. And then parents are responsible for their children when they're minors, age 18 and younger. So I don't really know what the definition is, for legally responsible, but spouses are responsible for each other, right? They got to take care of each other. And the same thing with parents. Parents got to take care of their children. Does that help?
Yeah, I'm just wondering if, say you have a parent with an older disabled child. So, in the case of the next slide, Dan and Donna isn't responsible, but if Dan had been disabled, would she be? But it sounds like she wouldn't because he's not a minor.
Right. And I think that's it. Even though he's disabled, he is over 18, and she would no longer be responsible for him. I hate to say it, but he'd have to kind of like stand on his own 2 feet kind of thing.
Right. Well, there'd be other programs for him.
Right.
All right. Thanks.
Okay. So now I'm going to go back to the poll, and I'm going to share the results so you all can see them. And then this slide here, we've got our answers. So how did everybody do? Let's see. So yes, for the first one, just about everybody got it. The 3 criteria: applicants live in the same space, and applicants are related by birth, marriage, or adoption, and among whom there are legal responsibilities. So remember, all 3 of those criteria need to be met in order for people to be in each other's households for the Medicare Savings Program. So the second question, Karen is 65 and Tom is disabled. Most of you got this one right? They are not in each other's households. And that is because they're not meeting all 3 of those criteria. They are married, so they are related by marriage. There are legal responsibilities among them, but they're not meeting that first criteria. They're not living in the same space. So Karen and Tom in this scenario are not in each other's households. Let's see the third question. And again, most of you got this one right as well. So Karen, again, she's 65 and Tom is disabled. In this case, this scenario, they are not married and they live together. So again, they're not meeting all 3 of those criteria. They're living together, but they are not related. They're not married, so they're not related. So no, they wouldn't be in each other's households. The third question, Karen and Tom, same couple. Karen 65, Tom is disabled. In this scenario, they are married and living together, and living with them is Karen's 42-year-old daughter. So is Karen's daughter in the same household as Karen and Tom? And most of you got this one correct as well. No, Karen is not in the same household. Excuse me, Karen's daughter isn't in the same household as Karen and Tom. And that's because Karen, well, the next question, Karen is no longer responsible for her 42-year-old daughter. So that last one, yes, most of you got that one correct as well. Any questions? I see one in the chat. What about when a court makes you the legal guardian of a disabled adult child? So if you are the legal guardian, do you technically have, are you responsible for them? Are you, you might be handling their money. You might be supporting them, providing a living space. When the court makes you a legal guardian of a disabled adult child. That's a good question. I will have to look into that because it's all hinging upon, you know, what the definition of the legal guardian. And Patty, can you shed any light on that? Yeah, I'll have to look into that one because I am not 100% sure. Oh, she's trying to unmute. She's letting us know. Well, Patty, when you get it, or put it up in the chat if you can't unmute your mic. Now, our next section is calculating income. So how do we do it? So the Medicare Savings Program looks at unearned income. So unearned income is income from sources such as Social Security, Supplemental Security Income, which is SSI, workers' compensation, pensions, retirement, anything that's not wages, not earned, like self-employment would be earned income. And when you're dealing with unearned income, there are these disregards. So non-Magi screening, which is also known as SSI-related screening, uses certain disregards, certain amounts that can be deducted, subtracted from gross monthly income for eligibility purposes. Eligibility for the Medicare Savings Program uses non-Magi screening, also known as SSI-related screening. So that's where this $20 disregard comes from. And then the state, Maine, has added its own disregards of $55 for a single person and $80 for a couple. So we've got a question here from Pamela. Do reverse mortgages count as unearned income? No, because in the end, the reverse mortgage has got to be paid back. So it's not counted as income. And I know I just don't know where it is in the eligibility manual, but I know there is a rule around reverse mortgages and it's not counted. It's probably in that income section. I think it's part 17 in the eligibility manual that's put out by the Secretary of State. So the disregards, Cordelia is asking, the disregards would be put towards monthly income, correct? So they are subtracted. The disregards are subtracted from monthly income, making the countable monthly income lower. Does that help, Cordelia? Great, thank you. Okay, so Patricia also put up back to the legal guardian question. A couple with a daughter, they have guardianship, and if they didn't, she'd be a ward of the state or someone else. She'll never be autonomous. So again, I've got to look up and see how, you know, if the legal guardianship means they are legally responsible, and therefore they count for the person who's applying for the MSP. And it's all hinged on that legal guardianship. Okay, so now back to the disregards. So again, the federal disregard for it's $20, and for a single person, it's $55. So when someone has just unearned income, it's fairly easy for a single person, you're going to subtract $75 from their gross monthly unearned income. And for a couple, you're going to combine their gross monthly income and then subtract $100. And the $100 is the federal disregard of $20 plus the state disregard of $80. And again, typically someone applying for the Medicare Savings Program will only have their monthly Social Security benefit as income. So be sure to use the gross monthly amount. You cannot subtract their Medicare premiums and go with that figure. You've got to make sure their Medicare premiums are included. And then remember, when screening for eligibility, remember to subtract the disregards from gross monthly income because they lower the applicant's monthly income. Keep in mind, the Medicare Savings Program uses monthly income to determine eligibility. And here's a neat little caveat with the eligibility. If you're working with a couple and they are over the monthly income limit for any one of those tiers in the Medicare Savings Program, but one spouse needs more assistance than the other, the spouse that doesn't need the help can be deemed the ineligible spouse, and $420 can be subtracted from their income after you've done the other deductions. And in some cases, this does make the spouse who needs the help eligible. And when you're doing this on the application for the Medicare Savings Program, be sure to indicate which spouse you want to have deemed disabled, so the eligibility person running the application will see that. And if there's earned income, there's some additional steps to follow. And I'm going to get into that as well. So earned income. So someone may have wages, right? Maybe somebody's working part-time. Maybe it's a couple and one spouse has Medicare and is fully retired and receiving their Social Security benefit. Well, the other spouse isn't old enough yet, or they are, but they're still working. They've got wages. So when you're working with wages, earned income, you've got to figure out what the monthly earned income is going to be. And here's how you do that. So you take, if someone's paid weekly, you take their weekly paycheck, the gross taxable amount, and multiply it by 4.3 to get the monthly amount. If they're paid bi-weekly, every other week, you multiply their gross taxable amount by 2.15, and that gives you the monthly amount. If someone's paid bi-monthly, usually the 1st and the 15th, or the 15th and the 30th, you multiply that gross taxable amount by 2, and that gives you the monthly amount. If someone has fluctuating income, say they are applying in July and they've had fluctuating income since January, you take their year-to-date income on that last pay stub for July, divide it out by the number of weeks. So count that week and count back to the first week in January, and divide the year-to-date number by that number of weeks, and that'll give you the average weekly income, and then multiply that figure by 4.3 to get their average monthly income. Self-employment, it's based upon their most recent tax return, and honestly, with the MSP, I haven't helped anyone who has self-employment income. It's always Social Security and pensions and retirements. And in some cases, some folks do have wages. Let's see here. So again, typically someone applying for the Medicare Savings Program will have only their monthly Social Security as income. But from time to time, you do run into people who have that Social Security and also have earned income, also have wages. So here is how you calculate income, countable income for the Medicare Savings Program. So remember, Earned income equals wages. It's income from self-employment, income from rentals, it's wages. Unearned income, Social Security, retirement, or a pension. So what you've got to do is, if you're working with somebody who's only got unearned income, Social Security, for example, you subtract the federal and the state disregard and compare that number to the income limits, and you're done. That's it. But if somebody's got earned and unearned income, there's a little few extra steps you've got to go through. So when someone does have both sources of income, make two lists, one of all earned income and then one of all unearned income, excuse me. Subtract the $20 for the federal disregard from the total unearned income, and then set that number aside. If there is no earned income, you can go right to step 5. But if there is, you've got to do these little extra steps here. So with earned income, you add it all up and then subtract $65 from the total. And this is, again, this is another disregard. And this one can only be taken from earned income. You cannot take it from unearned. So once you've subtracted that $65, you divide the rest in half and hang on to it. So then you add the earned income, that figure that you've got, back to the unearned income after you've taken that $20 disregard. You add those two back together, and then you subtract the state disregard from the combined earned and unearned income. So for a single person, you will subtract $55. For a couple, you will subtract $80. And then if it is a couple and one spouse is going to be deemed ineligible, or if they're over income and one spouse has greater need than the other, you deem the spouse that doesn't have the need ineligible and subtract that $420. Let's see. So are there any questions here? Because this can be a little tricky. Again, the $65 is only subtracted from earned income. You can't take that disregard from unearned income. From unearned income, and if they only have unearned income, you can subtract the $20 plus the $55 for an individual. And if it's a couple, combined income, subtract the $20 and then subtract the $80. Again, that's unearned income. Any questions? Okay. So let's practice some of this income counting. So we've got Donna and Dan again. Donna, as we stated earlier, is a household of one because there's no legal responsibility between her and her son. Donna's monthly gross Social Security benefit is $1,725. And her Medicare Part B premium is subtracted from this. But again, we use gross amounts. We can't subtract that Part B premium and then run the math. And because Donna's income is solely unearned income, it's her Social Security benefit, we subtract $75, the $20 federal, and then the $55 state disregard. So 1,725 minus 75 gives us 1,650. And this is her countable income. So Donna's countable income is under the income limit for Quimby, which is $1,699 a month. So she is eligible for Quimby. It will help with her premiums. She'll get the Part B premium back, and Quimby will cover the Part D premium. It will also help with Part A, any expenses that she incurs if she goes into the hospital. So Donna is eligible for Quimby. So we've got 3 examples to work through here. So here we've got Ron and Marge. They're both married. Ron's still working. He's 63 and he's got $600 a week in wages, and his health insurance comes through his employer. Marge, she's retired. She's receiving Social Security benefits at $1,150 a month, and she's got Medicare Parts A and B. So let's figure out their income. So we know that for purposes of the Medicare Savings Program, their household size is 2. And why? It's because they're married and they're living together. There are legal responsibilities among them. Ron doesn't have Medicare yet, so he can't get the Medicare Savings Program. Marge does have Medicare, so we're going to screen and see if she's eligible for it. So again, first, we're going to make 2 lists because we're working with earned income. Here, we're working with Ron's wages, and we're also working with unearned income, which is Marge's Social Security. So let's take the earned income part first. So Ron, he's paid $600 a week, and we need to figure out what his monthly income is. So we take $600 and we multiply it by 4.3, and that gives us his monthly income of $2,580. So we've got $2,580, and what can we subtract from it? What do you think we can subtract from it? No, Cordelia, it's not 100. Remember, this is earned income. So remember, from earned income, we subtract $65. And then we divide it in half after we subtract that $65 disregard from earned income. So that's going to give us $2,515. And then we divide that in half. So we take the 2,515, divide it by 2, and that gives us $1,257.50. Yes, Dana's, it's $65. So remember, from earned income, it's once you get the monthly amount with wages, once you get the monthly amount, subtract $65. That's the disregard, and then divide it in half. And what you're left with is the countable income for wages. Any questions there? Okay, so now let's go on to unearned income. And we know Marge has unearned income. It's her Social Security benefit. Wendy's asking, why is it divided in half? It comes from the rules for non-Magi screening. It's also, non-Magi is also referred to as SSI related screening, and it's in those rules. Yeah, I looked the other day and found that it's in those rules. So remember, with earned income, you get the monthly amount first, and then subtract that $65 disregard, and then divide it in half. And once that last number you get, that's the number for countable income. $100 disregard for unearned income, right? Right, so that is the disregard. And it's $100 because we're working with a couple here. So it's $20 for the federal disregard and $80 for the state disregard. So with Marge, we're going to take that 1,150 and subtract 100, And that's going to give us Marge's countable income of $1,050. So our next step is to add the two together. So we're going to take Ron's countable income from his wages, which is that $1,257.50. And then we are going to add Marge's $1,050, and that's going to give us their countable income of $2,307. But there's a little caveat here. We know Ron is not eligible for Medicare yet, so therefore he's not eligible for the Medicare savings program. So we can subtract that $420 because he is an ineligible spouse, and that is the ineligible spouse disregard. So we can take their $2,307.50 and subtract the $420 for the ineligible spouse disregard, and that's going to give us $8,887.50. And by doing that, that is going to make Marge eligible, I believe, for Slimby. No, eligible for Quimby. Okay, I think that's wrong. Marge is eligible for Quimby. Quimby covers all the premiums and out-of-pocket costs. Marge will have no doctor bills, and she will have small copays for prescriptions. But as you can see, I've made a mistake here, and Marge is actually eligible for Slimby. The $1,887.50 is over the income limit. Oh, no, wait a minute. Excuse me, I'm looking at the single instead of looking at a couple. I'm sorry. With that the monthly income limits chart there at the bottom of this slide. So the couple, the income limit for Quimby is $2,289, right? So she is under that income limit for a couple. So she is eligible for Quimby. Right there. Sorry about that. I was looking at the figures for a single person. So yes, Marge is eligible for Quimby in this scenario. Any questions before we move on to Lila and Anita? Okay, so here we've got Lila. She's 23, she's in college, and she has no income. Anita, she's 67, she's retired. She claims Lila is a dependent. Anita's receiving $800 a month from a pension, and she's also got $1,000 a month in Social Security. And in this scenario, Anita does have assets, and her assets are $54,000. She has Medicare A and B. Those assets are also liquid, so we've got to count them. So in this scenario, we are not working with earned income. We are working only with unearned income, and that's because Anita has no wages. She has no earned income. So we are going to take and combine her pension and her Social Security. So 800 plus 1,000 is going to give us $1,800. And then we are going to subtract the disregard for unearned income. So what do you all think is that disregard for Anita? How much do we get to subtract from Anita's $1,800? Sandy's saying 65. Remember, the 65 is from earned income. It can only be subtracted from earned income. Let's see, I see some of you've got it. It's $75. Patty's got the $420. And remember, the $420 is the ineligible spouse disregard. And in this scenario, we don't have a spouse. It's Anita on her own that's applying for the Medicare Savings Program. So here, we can't use that 420 disregard. But everybody else has got it. It's $75. So it's the unearned income, and it is that $20 from the Fed that can be subtracted, and then $55 from the state. And that's the disregards that can be subtracted from Anita's monthly income. And that's going to give us $1,725. So that is Anita's countable monthly income for the Medicare Savings Program. So now let's look at her assets. So we know her liquid assets are $54,000. And the first $8,000 of those assets are excluded. They're not counted. So we can subtract the $8,000, and that's going to give us $46,000. So here, Anita is also under the asset limit of $50,000 for a single person for the Medicare Savings Program. So is she eligible? Yes, she's under the asset limit for the Medicare Savings Program. She is over the income limit for Quimby for a single person, $1,699, but she is under for SlimB, $1,926. So SlimB is going to help with the Part B premium and the Part D premium. And with Part D, it's also going to help with the deductible and the donut hole. So this is good for her. It's going to help. And here, let's see. Right. Dana's got it. It says the ineligible spouse or child on the chart. Is the child not counted because they are 18 older? Or yes, that's right. So let's go back here. So right, Lila is not counted in Anita's household because she's 23. If she were 17, then she would be counted. But too, this scenario doesn't say if they are mother-daughter or grandma and granddaughter. So if Lila is related to Anita and 17 years old, then yes, we could do the ineligible spouse, because she'd be the ineligible child. You guys are asking excellent questions. Okay, so now let's look at Jim and Leslie. They're married. Jim's retired. He is receiving $1,210 a month in Social Security benefits. He has Medicare A and B, and he needs a lot of meds. He's got some health issues and he needs a lot of medication. Leslie, she's retired as well, and her monthly Social Security benefit is $1,500 a month. She also has Medicare A and B, but she has fewer health needs. Together, they have assets that total $86,000, and these are liquid assets. So let's take a look and see if they are eligible. So let's do the math. So we need to add Jim's retirement and Leslie's retirement, Social Security benefits. And that's going to give us $2,710. Now we get to take the disregard. So here, I'm going to ask you all again, what is the disregard? Yeah, Dana's got it. It's $100, and it's a couple. So remember, $20 for the federal disregard, and because they're a couple, $80 from the state. That's $100. So we get to subtract $100, and that gives us $2,610. So now let's look at their assets. So they have assets totaling $86,000, and again, for a couple, the first $12,000 in assets is excluded. So we can subtract 12,000 from that. And that's going to give us $74,000. So they are under the asset limit as well. Are they under the income limit? 26. Under for QI. But let's see. Can we do better? So, right, together they're eligible for assistance in the qualified individual tier of the Medicare savings program. But Jim needs more help. So we can deem Leslie ineligible, and that will subtract $420 from the $2,610, and that'll give us countable income of $2,190. So that would bring Jim under the income limit for Quimby for a couple. So by deeming Leslie ineligible, she won't pick up the MSP, but Jim needs more help than she does. So he could pick up Quimby, and with Quimby, he wouldn't have any medical bills, and he'd receive help with his medications. So let's see. Right. Dana's got it, 420 in eligible spouse disregard if Leslie isn't taking the MSP. And then Cordelia, would you just write in on the application an eligible spouse disregard by Leslie's name? Yes, I would. And I would highlight it, put a star, put arrows so that they would see it, be sure to see it. Yes, I would. And there's the ineligible spouse disregard, the 420 that we can subtract here, getting Jim into Quimby. No, Patty's asking, why can you deem her ineligible? So we can deem her ineligible because Jim has a higher need. He has health problems and he needs many medications. Getting him into Quimby would also help by, if he were to go into the hospital, everything with Part A would be covered by Quimby. The Part B premium he gets back, and then any expenses like the co-pays and the deductible with Part B, Quimby would also be covering that for him. And then with Part D, the premium is picked up. Quimby's covering that. Quimby's covering the deductible for Part D and also covering the donut hole. So by getting him into Quimby, yeah, Leslie's not getting the Medicare savings program, but for him, Quimby is going to cover all of his medical costs. He should not see a doctor bill. And, it may be something that would be beneficial if he were in Quimby. Maybe in this scenario, might be worth it to look at both and see if both of them getting the Part B premium would be better. But for this scenario, I just wanted you all to see that even though they're both eligible for QI, it may be more beneficial for Jim to have Quimby and have all of his medical care covered. Does that help, Patty? It's always good when you're helping folks figure out eligibility for the Medicare savings program. It's always good to ask them, maybe ask them about their healthcare needs. Maybe just in talking with them initially, it's a couple and you don't know one is not as healthy as the other. You don't know, they don't tell you. So maybe asking them some questions to ask that, because maybe one of them having Quimby and the other one not having the MSP at all may be the way to go for them. I don't know. I always ask questions when I'm helping folks. So here we're going to go over applying for the program and then annual reviews. So we do now have My Main Connection. It's been revamped over the summer, and you can apply for the Medicare Savings Program there. I don't think there's a spot at the end for comments like there used to be with the old online application. So for the Medicare Savings Program, I think I'm still gonna use the paper application with the folks I'm helping. And that's because you can indicate, deem the spouse ineligible, or if there's something else wonky that's going on, you can explain it. You can write it on the application where you really don't have that option with the one online. So you can download, yes, the Office of Family Independence in DHHS determines eligibility. That's where the applications go. So you can download a paper one by using this link, or give us a call. That's the helpline number there, 800-965-7476. And we can get one to you. I email them to callers and folks I'm helping with this quite a bit. Be sure on the application to check that box that indicates they're applying for the Medicare Savings Program. It's on page 1. And then you can speak on behalf of the person you're helping, as long as the person you're helping has signed the release form. So if that's the case, be sure to download it, have them sign it, and they can send it in along with their application. So yeah, again, I recommend still using the paper application for the Medicare Savings Program, and that's because you can still write on the application any special instructions or considerations. Then once the application is all filled out and signed, you can mail it along with income and asset verification documents to Farmington, the address right there, up in Farmington. You can also email the application and supporting documents using the Farmington DHHS email address. And what I do in the body of the email is I'll put the applicant's name in the subject line. I'll say, Medicare Savings Program application. And then in the body of the email, I'll put the applicant's name, their date of birth, and the town they live in. I never, ever put their social security number there because you never know. And 2, if the application's attached, well, the social security number would be in the application too. But I will email applications. They seem to get there a little bit quicker. You can also fax them along with the documents using the fax line, which is 207-778-8429. For asset verification, if it's bank accounts, savings accounts, those sort of things, the most recent monthly statement, so they can see it. Income, lots of times I'll tell folks if they can put their hands on that annual statement they get from Social Security, we can include a copy of that. If it's wages, of course, most recent pay stubs. If they're weekly, the last 4. If they're paid bi-weekly, the last 2, because again, it uses the Medicare Savings Program uses monthly income. So let's see here. And Valerie's awesome. She's putting up information in the chat. The link to the release. And then the address to mail the applications, and the email address, and the fax number. And then Cordelia's asking, would you just look down the supporting documents list and include copies of whatever seems relevant? Yes, I would. The paper application has a cover sheet, and on the back side of that cover sheet is the list of documentation. Oh, and yes, too, with the paper application, there's a spot that asks for their Medicare ID number, Part A and Part B, and it asks when Part A started and it asks when Part B started. Be sure to fill that section out. And then you may want to include a copy of their Medicare ID card as well. Let's see. So Patty's saying she recently experienced They want you to wait until you get a client ID before sending the supporting documents after an emailed application. I know when I have helped somebody with sending something via email, I will, if I have the applicants, if they've got main care or they're already got the MSP, I will include their ID number in the body of the email, along with their date of birth and the town they live in. And my thinking on that is it may make it easier for the eligibility person or the person picking up that email to link those documents with that case file. Yeah, I don't know. Martha's saying that process the application on the spot if you go to a local DHHS office. I haven't heard of that happening. You can drop off the application at your local DHHS office, and then what happens is they scan it and send it off to Farmington. Everything's got to go through Farmington. That's where I should say they scan it. I shouldn't say they scan it. They send it off to Farmington for scanning and uploading into the applicant's case file if they've already got one, or they must create a new case file if it's somebody new. Yeah, and Cordelia's asking if any issues with emailing things like social security number, pay stubs, etc. Again, in the body of the email, I won't put in the social security number. I just put in the person's name and date of birth and the town. But I have sent copies of pay stubs with the application through email, and I haven't run into that problem. But you're right. It is a something to be cognizant of, that it could get hacked. Somebody's social security number could get out there. But fortunately, I haven't had that experience. Yeah, timely document receipt in Farmington. Well, I know when you, if you email something, you do get a response that it's just one of those automated response that they have it. And I do know it does take, like if you fax or email up the release, you've got to give it a few days before it's processed, before you can call DHHS and go over the applicants, if they've been denied, or go over the applicant's application. It does take a few days. And then when they get busy, it can take, I don't know, I had an experience once where it was 5 days. I had to wait 5 days before I could speak with an eligibility person. And I just, try and be patient. We're all trying to help folks pick up coverage. We're all trying to help folks, receive a benefit that they're eligible for. So I just say, try and be patient, be kind when you're talking with folks at DHHS. And then once, oh, that's good. Yes. Patty's saying they've been really fabulous with her. That's good. So then again, applying, once the application is in, remind the folks that you're helping that they will receive their eligibility notices in the mail. It's important to check the mail. Don't pitch the envelope that comes from the State of Maine Department of Health and Human Services Office of Family Independence. Don't pitch it. Open it up. Take a look at it. And it'll have their eligibility results. It'll say, if they're eligible, it'll say something like the state is picking up your Medicare premiums, or it may say now the Medicare savings program, because I know they've redone the eligibility notices and now they've got that chart on there, but they used to say you're eligible for the buy-in. So just tell folks that you're helping that notices will come in the mail, and don't throw them out. Open them up, take a look, read them. Remind folks that you're helping to keep their mailing addresses updated with DHHS. If they move, they should contact DHHS to update their mailing address. And then once the application has been submitted, they can check on the status of that by calling the inbound line at OFI, the 855-797-4357 number. And what I will do is tell folks, give it a couple weeks, give it 10 days or so, and follow up and just check to see that they have your application. And if they say they have it, check to see if they're eligible for the Medicare Savings Program. But the important thing is remind them to check the mail, because notices are sent in the mail. And then also keeping mailing addresses updated, because DHHS mails notices. And if they miss the notice, then they're denied, they may actually be eligible, but they'd have to reapply. If they don't get the notice, they'd have to reapply, do the whole process over again. So the annual review with the Medicare Savings Program, the department does review eligibility every 12 months. So it's 12 months from the month that the program opened. So say somebody applied in June, the Medicare Savings Program opened up in June, their review would be probably like May of the upcoming year. So I just remind folks, tell them of the annual review to be on the lookout for the mail, because it'll be sent in the mail. Sometimes with main care, we used to hear that people would go to the pharmacy and their main care had closed, so they would get stuck with the full cost of their medications, and they didn't know that they had missed the annual review. So that's why it's very important to remind folks to check the mail, let them know about that 12-month review. And I'll even tell folks, just put it on your calendar for next year, just put a little reminder there saying, my review's coming up, be on the lookout for the documents. And with the review, that's the time that you update income and asset information if anything's changed with their households. And then once the review's processed, DHHS again will send a notice that the program, they're still in the Medicare Savings Program, or they'll get a notice that the beneficiary is no longer eligible. And if that happens, they can let you know, right? So you can try and help them, or they can call themselves to find out what's going on. Ask, what happened? Why am I no longer eligible? And they should do that within 30 days of getting that notice that they've lost the benefit. If they go beyond 30 days, they will need to reapply. Let's see. Pamela's is the document something they must present to doctor? Yes. Oh, this is a good question. Yes, they should. When they get the notice that they are receiving the Medicare Savings Program, yes, they should show that to all their providers and their pharmacy. So that way the providers know they can bill it correctly. Same thing with the pharmacy. The pharmacy can bill it correctly. Let's see, the notice from OFI has the effective date. Yes. Their ID number. Yes. Thank you, Martha. Yes. I know my dad, he had Quimby and he had main care, and I took him to see his primary care doctor a couple times, and both times he got billed that $35 copay, that Part B copay. And thankfully, doing this work, I knew that he should not be paid, he should not be billed for that copay. So I called the billing department and I left a message, and I left his main care ID number and information that he had Quimby, and sure enough, the bill got taken care of. So yes, thank you for asking those questions. Good questions. Yes, let providers know, let the pharmacy know that you've received this benefit. So a recap, the Medicare Savings Program, it's main care helping with the Medicare premiums and out-of-pocket costs. And personally, I enjoy helping people apply for the Medicare Savings Program, because once they get it, it is such a help to them. They need to have or be eligible for Medicare Part A. to get the Medicare Savings Program. And then anyone who is eligible for the MSP does pick up extra help, also known as the low income subsidy, but it doesn't go the other way. If somebody picks up extra help, they're not automatically enrolled in the Medicare Savings Program. So if you are working with somebody who has extra help, ask them about the MSP, and if they don't know what it is, screen them for it. And if they're eligible, encourage them to apply. Chances are they are eligible for it. Accountable income for the Medicare Savings Program, it's 150%. Up to 185% of the federal poverty level. There is an asset test, and it's the same across the 3 tiers in the Medicare Savings Program, and there is no estate recovery with the Medicare Savings Program. When the changes were coming about to estate recovery, a lot of people were asking, well, does it apply to the Medicare Savings Program? And no, it doesn't. And we've got the calculation for eligibility, the income calculation, the household construction piece. This is all in our main care eligibility guide, and it's section 4.1.2. Are there any questions? Let's see. Yes, Cordelia's asking, yes, when we're going to ask you all to do a survey to see how the training was. And with that email will be the links to the slides and also the link to the recording. Yes. Oh, and I see Valerie's already answered that question. Thank you. And then Valerie's also put the link up to our main care eligibility guide. Any other questions? We have a few more minutes. And if you've got questions too, feel free to reach out to me. My email address is right here, hroy@mainecahc.org, or give the helpline a call. My colleagues on the helpline are very knowledgeable, very kind and considerate, and are willing to help people figure out if they're eligible for the Medicare Savings Program. You're very welcome. Very welcome, Wendy. I'm glad you guys are here. Well, you all are very welcome. Thank you. And again, you will get the link to the recording and also the link to the slide deck. Thank you all very much.